So the question is, while overseas, this particular patient is from Russia. This patient decided to get the tooth removed and have an implant placed, and the way the implant happens is you need to allow for the implant, the dental implant, to heal before a crown is placed, which usually takes about 3 months. So this person is asking whether he can have the implant done overseas and then come back to America to have the crown done. And he's asking whether it is a good idea or not. So in general, my recommendation is not to have an implant placed in one part of the world or one part of town, and I should say one part of the world, because within the US or within the same country, the practices may be the same. But if you have things done in one part of the world and then you go over to the another part of the world to have the work completed, things may be completely different, and it may end up costing more than what it would normally cost to have everything done in one place. And then I'm not even worried about the cost, but sometimes you may not be able to find the parts and pieces needed to be able to complete the type of treatment that you need. Let me give you this example. Like, it's kind of like going to Europe and then you're going to buy a car in Europe and you're going to come to America to drive the same car. It's not going to be the same car, because a lot of times if you're not going to buy the same brand of car that is available both in Europe and America, then you're going to end up in a situation that you can't even find parts and pieces in America. The same thing applies to the dental implants or any type of medical devices also. The medical device implant, dental implant, is a medical device. So if you're going to get things done in Russia and the same type of device may not be available, or it may not be FDA approved, the Food and Drug Administration approved in America, so we may not be, as surgeons in America, we have to be compliant with the FDA, so we may not be able to complete the type of implant that you got it done in Russia, which may not be approved, which is not FDA approved. When you come over to America, we can't even touch that implant. And if you have possibly an FDA approved implant, for example, the top 4 or 5 brands that we use in America are Nobel Biocare, Straumann, Zimmer, Astra, Dentsply. So these are 3I. So these are top 4 or 5 brands that we use in America. So if you got one of those brands that was done overseas, possibly that we may be able to complete that treatment in America. But again, we are going to give you a disclaimer, because we are not the one to place the implant to begin with. We may not be able to guarantee that implant is going to work. So overall, my recommendation is, if you are going to start the process in one part of the world, have it completed if possible in that part of the world, and don't expect things can be completed when you are going to get done overseas. And being in Texas, I do have a lot of patients that go across the border to Mexico, Costa Rica, and we have a lot of patients that come from Asian countries, China, Pakistan, India. So they actually bring those implant parts and pieces with them, because the surgeon told them, whoever placed the implant overseas, they are telling them, okay, take it to the surgeon whoever is in America to get the treatment completed. But I repeat the same story when they come over to us, and then I tell them, hey, I'm sorry, I cannot touch this implant. Go back to whichever country placed the implant, you have to have the treatment completed. So long story short, it is a little bit difficult to control some of the factors. It is better to start the treatment in one place and finish the treatment. And particularly a lot of the times that the treatment is being done overseas for saving some money, but by doing what you're asking to do, it will actually end up costing more, because you have to travel multiple times to this country to have the treatment completed. And I hope this answers your question.
Yeah, if you're looking to